Hello. This video will talk you through some of the key milestones in your pregnancy. Your pregnancy is dated from the first day of your last period. You actually become pregnant when your ovaries release an egg which is then fertilised by sperm if you have sex. 5 to 6 days later, the fertilised egg burrows into the lining of the womb. This is called implantation. The first sign you are pregnant is when you miss your period. This is the time to take a pregnancy test. If the test is negative but you still think you might be pregnant, wait a week and take the test again. Once you have a positive pregnancy test, see your GP to start planning your antenatal care. Antenatal means before birth. At about 7 weeks, you might start to suffer with morning sickness. This can happen at any time of the day and may last until 16 to 20 weeks. If the sickness is severe, you may need rehydration and anti-sickness medicine in hospital. At around 10 to 12 weeks, you will be invited for a dating scan. This is an ultrasound scan to check whether you're expecting more than one baby, to confirm how many weeks pregnant you are, and to check the baby is developing in the right place. Your due date may change after this scan. You will also be offered screening for Down syndrome and other chromosomal abnormalities. Between 18 and 21 weeks, you'll be offered an anomaly scan. This is to check that your baby's organs are developing properly, and to look for several different conditions. Around this time, you'll also start to feel the baby moving. Get to know your baby's usual pattern of movement. If you think the baby is moving less than usual, tell your midwife or maternity unit straight away. At 24 weeks, your baby has a chance of surviving if it is born early or prematurely. However, if the baby survives, there is an increased risk of disability. At around 24 weeks, you might start to develop swollen feet. This is normal in pregnancy, but your midwife will check your blood pressure and urine to look out for a condition called preeclampsia, which can be dangerous. At 32 weeks, your baby has usually moved to face head down, ready for birth. At 36 weeks, irregular tightenings may start in your lower tummy. These are called Braxton Hicks and happen before labour itself starts. At 37 weeks, your pregnancy is now considered full term. The average baby weighs 3 to 4 kilograms at this time. The baby moves down further into your pelvis, ready to be born. Most women go into labour between 38 and 42 weeks. At 41 weeks, you may be offered a membrane or cervical sweep to stimulate the cervix and trigger a natural labour. This is done by your midwife putting their finger inside your cervix. If you haven't gone into labour by 42 weeks, your medical team will suggest that labour is induced, which means using medications to stimulate labour. This is because the risk of stillbirth increases after 42 weeks. If you have any questions about pregnancy, please speak to your midwife or GP.